there was a study that was done on just looking at rest, and it was the first RCT that was done on rest, and this kind of set the tone and started this whole process around questioning rest. Now, this is the Thomas study. So Thomas et al. In 2015, they had adolescent participants, so 11 to 22 years old, were recruited within 24 hours of their concussion. So immediately after their concussion, they underwent all sorts of different tests, and then they were randomized to either get 1 to 2 days of rest and then a gradual reintroduction of cognitive activity and physical activity. The other group was randomized to receive 5 days of strict rest. So completely random groups. And what they found was there was no clinically significant difference in the neurocognitive or balance outcomes of the two groups immediately at onset. However, the intervention group, meaning the group that got 5 days of strict rest, reported more daily post-concussive symptoms and slower symptom resolution. Conclusions: recommending strict rest for adolescents immediately after concussion offered no added benefit over usual care. Adolescent symptom reporting was influenced by recommending strict rest. Patients that were told to rest for 5 days were actually worse off than patients that only rested for 1 or 2. So this calls into question the whole idea behind rest. Another study from 2015 found that patients that listened to their doctor's advice about having strict rest did worse than patients that did not listen to their doctors and decided to go back to activity early. So this is more evidence to show that rest is potentially detrimental. Now, there's other things that rest can do that are potentially causative of this, but we don't really know if they're causative or not. But resting, or telling somebody to rest, or telling them to avoid all activity and do this cocoon therapy, darkroom therapy, medicalizes the condition. And what I mean by that is it creates potentially anxiety within the patient that they have something super serious, something that needs to be completely shut off their brain, and if they see a light, they might have, they might get worse, or if they look at a computer screen, then that's going to make them worse. And all of these things create what's called the Nocebo Effect. Okay, so the Nocebo Effect is the causation of sickness just based on the expectation of sickness. So even the media hype right now around concussion is probably creating a lot of nocebo effects where patients are having worse outcomes because they perceive the condition to be more serious than what it actually is. So telling somebody to rest and not do anything and not look at computer screens and not go to school and not use their brains medicalizes the condition where they believe, oh my God, I have something super serious, and that creates the anxiety and all the other factors that may go along with it. Also, darkness can create depression. Social isolation creates depression. The symptoms of depression oftentimes link or are very similar to the symptoms of concussion. So again, the mental health aspect of concussion, we have to ask the question, is that due to concussion injuries, or is that due to the way that we were treating them? Is that an iatrogenic effect? Meaning, does that come from the way that we were caring for these injuries, telling people to sit in the darkness, don't talk to anybody, don't go out, don't do anything, and completely socially isolating these patients to the point where they're depressed, they're anxious, and their symptoms are not going away because they're the symptoms of depression and anxiety that comes with it, okay? Next up, you have physical deconditioning that happens with rest. Concussion creates changes and alterations in the blood flow to your brain, how your brain is able to shunt blood to different working areas, how your brain vasculature is able to accommodate changes in blood pressure due to physical activity or anything else. If you are resting and doing nothing, rest alone affects your brain blood flow. So you have a concussion that affects brain blood flow. Then we're telling patients to rest, which is compounding the blood flow issues that they have. Now, this is one of the top theories behind exercise as a treatment for concussion, is to improve the blood flow mechanisms that are impaired when a concussion injury occurs.